Uh, Hi, good afternoon, everyone. Um, for, I mean, the topic was smart healthcare for smart doctors. I mean, is there anything ever better than smart doctor? I think all doctors are smart. Do you even have a smarter doctor than the existing doctors? That was the paradoxical question that I had. And I believe that how to reduce cost, as my colleagues and peers have already told, and my seniors have already told over here, that if you don't adopt technology, there is no other way. And if you don't, the government would definitely force you very soon. It's being mandated. It's being, our healthcare system is fragmented, as you know. So if I had to start with why are the costs high, is not only because of the hospital, the land, the equipment costs is high. These are all traditional ways of spending, or the traditional reasons. Yes, that the land would cost this much, an MRI machine would cost this much, the doctor's salary is very high. Those will always be the case. That will never change. What can we change to reduce all of that is purely adoption of technology. And by technology, I don't mean an EHR system. An EHR system is the base. That is the crux. Where do I see is, until we have that common medical Aadhaar for us, we will always be struggling. Because someday a patient has come to me, the next day he has gone somewhere to another city, he has to do the test again because 6 months I won't refer. He might have forgotten the diagnostic test. There is no linkage of that. Until we have that medical Aadhaar, we will never be able to have technology adoption. Why is everyone failing into that technology adoption is because people are trying to, at each hospital, at each level, at each healthcare facility, everyone is trying to tell them to adopt our technology. If you have come, okay, register again. If you have done, do our diagnostic test again. If you have come to our center, okay, go through our pharmacy, go through our processes, go through your, give me your snapshot, give me your photo, tell me your phone number again. If we keep on doing this, if we keep on reiterating the already invented wheel, we will never be able to adopt technology. For a nutshell, the building blocks of what healthcare is the pharmacy, the lab, the diagnostic images, the CT scan, the MRI, the doctors itself. But this is a medical Aadhaar for me. One thing that any hospital, a nurse, a patient, a clinician, something that just tells that if I have come here, 3 months ago, I might been in Gwalior and had shown to a gastroenterologist. 2 months down the line, I might be suffering from a flu in Mumbai. I might go to an internal specialist. Somewhere down the line, I need this kind of centralized data for technology to kick in. Otherwise, everyone is still struggling for the technology to come in. I'm very sure I would probably ask Dr. Sandeep, I don't know, in metro, are all metro groups hospitals connected to one server? If someone is coming to Metro Noida and someone goes to Metro Haridwar, can the Haridwar team pull up the data from the Noida people? If that has been done, they're doing a wonderful job. If that is not, it's not only about this hospital. Plenty of hospital chains, Apollo, Fortis, that centralization will always is only the basic crux for one partner organization. And this is where the government would soon kick in, that they are already launching Ayushman Bharat, as you know. They are launching a global insurance scale on the level of the US, like a social security scheme and a health scheme. And they will use this data. Disha Act is already here, where you can't transcribe a lot of startups. So I invest into a few startups, and the generally all startups wants to do, they want to cure diseases, they want to help the society, they want to figure out how they can tell breast cancer screening through AI. But most of them struggle is getting the data. How do we first of all get data for thousands of patients who had already suffered? Once you have that data, you can obviously reiterate it, build an algorithm around it, model your presentations. You can figure so much once you have that data. The only question is, how do you get that data? And that has been interesting insight that I had seen, that since I've worked with a lot of startups. So one of the startups said that I have failed in getting the data, let me implement an EHR system only. They started making an EHR system first of all. The second question became the deployment. How do you deploy that? You need a team, you scale. They started going on that way. Another startup came up, this is also very challenging. Let me make a pen with the scanner with an image which will keep on clicking images of each prescription, and using AI, then we'll decode all the doctor's handwriting and we'll make a data out of it. Okay, good enough, you try that. The third person said that, it's very difficult for each doctor to, since multiple doctors are coming and multiple images won't be scanned, let me give a pad to each pen. Whatever pen they use, we will not even use an OCR technology. Wherever they scribble, we will get on those images. Okay, that's also a fair idea. The other person said the doctors are not even inclined to put anything on the system. They are very happy. And as Dr. Sanjeev was telling, it's not the tier 1 and all the metro and the corporate hospitals I'm talking about. It's generally tier 2, 3, 4, you name it, all the other except the corporate hospitals which mandate everything into the e-health adoption. What they did was that everybody, the prescription at the end of the day used to go to the pharmacist. They started giving an incentive to the pharmacist to click an image, and from that image they'll start pulling in data. Okay, good enough that they have found an alternative way. The third person started deploying in kiosk, how to make a smart OPD. When a person walks in, we will deploy a person, we'll give them issue a health card. The health card will then tell them to go to this doctor, they will employ more. So instead of technology reducing the cost, it started increasing the cost. Technology adoption should be easy. It should not be hassled. And as soon as you tell to a doctor or to a clinician or to the tertiary staff that just to write a prescription or to use everything or to digitize everything, you need to do 5 other things, the incentive is gone. For them, everybody has already burdened under a lot of load, lot of stress, and now to put everything onto a data-driven system, which probably the US has or the European countries have been doing it for a good 30, 35 years, is because that has been mandated to them. I have read a lot of case studies, and I can tell you that the amount of money that we spend in building up a hospital is only their IT budget. Minimum, they spend more than hundreds of crores just to building networking systems, just to bring messaging systems between doctors, paramedics, ambulance services, that is someone coming in. That's their minimum mandate, that the IT system should be there. The clinicians abroad do not work only until they figure out there is an intelligent smart device system built into the system where they can pull in the resources, and the data is giving them back information that yes, there were patients who have been suffering over this, you had prescribed earlier over that, and that has been the remedy. They have been so used to this intelligent feedback system already that now they feel handicapped if the server goes down. There have been a lot of research that once in a big hospital in Boston, the server was down, the whole hospital was shut for good 2 days until the server was back online. The doctors are so used to getting second feedback, unlike India, and I think this adoption starts from a medical college itself, where instead of a big room of doctors sitting on left and right and the senior doctor sitting in the between and the counseling going on that yes, you can prescribe this technology adoption, if it starts at that grassroots level, I'm very sure that probably when any doctor starts his or her practice, this evolution will come into play. So, as I said that the EHR is the basic and the most quintessential backbone of any hospital. And by EHR, I don't only mean that it's only an appointment booking system. I come in, you note my number, email ID, you have my picture, you tell me your appointment is at this time, come back next time. That's not an EHR system. That's a basic appointment booking system, which is very easy, and that is not what will give you the clinical relevance, or that is not what will help you in judging your patient's data. Abroad, there are cases when someone is suffering from Schrödinger's disease, and unless that data was fed into an app, and it gave a minute possibility of 8% that this person must be having a Schrödinger disease, because they had pulled in a lot of data from the internet. They had crawled everything, they had put an AI engine on top of it, and that person had already visited 12 doctors, and nobody was near the diagnosis of Schrödinger. So that's the power of technology. If you can pull in these resources, if you can trust technology as you trust your wife, yeah, this is my partner, I will use him or her to help me move forward. That is where you see technology, and only then. And for that, basic premise is an EHR. The challenges, I don't think so I need to reiterate. And what is the challenge for an EHR? It has its technological challenges, the business challenge, and organizational challenge. multiple challenges are there when you implement an EHR. Easily said and done. And these are a few points which I noted down, that why do you think it's not easy? If it was that easy, why not just install a software? People are not ready to use it. There is a cost adopted to it. The internet penetration is now there. You have diverse set of groups working in a hospital. It's not only the clinician's job. The reception front desk is different. Pharmacy is different. Accounts is different. Everybody has to be on the same page to adopt that. The knowledge, the technology transfer, if one person goes down, does the system break down, which has happened? And that's why the system never works. It's so dependent on one tech guy that he is the guru or he's the master. Any problem, it's like a computer guy. In India, we have a guy for everything. TV kharab hua, oh, call that guy. Koi lakdi toot gayi, call that guy. So we have a tech guy for everything. If he or she goes, that's where the whole system breaks down. So the adoption of technology or EHR faces multiple challenges, but there is no, the basic, how do you feel that an original person who comes into the system has gone out, what are the registry he goes, the lab, the pharmacy, everything has to be inbuilt on the system, and only then a layer of artificial intelligence, machine learning, natural language processing, blockchain technology, you name it. Everything can be applied. We have the brain, we have a lot of engineers from IITs, ISCs, lot of them, but they require that bit of data to work on. And that's been the challenge for every startup as of now. How to adopt to that data, how to get that data, because the hospitals aren't ready, or even they are ready. They face normal challenges, which I'm telling you about here. So, this is the different parts and the different practitioners in a daily life of hospital. So what is a smart healthcare? Is it only EHR? That's only, as I said, the basic building form of life. It's our O2 and H2O. But beyond that, it has to be an integrated, instrumented and intelligent system. Everybody is wearing a Fitbit today, a wearable today. How is it smarter if someday, as Dr. Sandeep was telling, that you can get India is the capital of heart attacks or cardiac diseases. If my wristwatch or if my Fitbit would tell me that I have an elevated heart rate and there must be something wrong, but how does it differentiate that if I'm jogging or am I lying down and I'm having that elevated heart rate? That is where the intelligence comes into. This is only, the device can measure heart rate. They have been doing that. But how does it differentiate from a cardiac arrest and from when I'm exercising? Or how does it differentiate my BP when I'm just lying down or when I'm shouting at someone? My BP is supposed to be elevated at that point in time, which is fine. But that is where the wearable devices adds on an extra layer. And people are working on that. And that's where any wearable technology will move in. That is how artificial intelligence is. If I have to tell you what artificial intelligence is, it's easier said than done. That what a human feels like is what artificial intelligence. We have already programmed computers to think in our way, but they have not learned to feel, see, visualize like we can. That is the difference between AI and us. A doctor's expertise cannot be easily replicated by an AI system. It will only figure out the data it has been given, and obviously it can compute through large amount of data and give a result, which is easy. So that's why it's been able to diagnose 45 years of data and give a prescription. But when a doctor or clinician sees and what he feels and what his gut tells, the intuitiveness, the pale color in his eyes, probably that is a symptom. Unless you can probably tell that yes, there is a pale color in his eyes and the AI system will give you something. But the doctors know that that pale color is yellowish pale or bluish pale and differentiate on that and probably figure out something with the AI system could. So we are evolving from that to this. That is where an AI system kicks in, that once it's able to do that, only then probably the clinicians and technology go hand into hand and bring affordable care into India. So one of the things implemented in US is e-prescription, which India is struggling is over there. It's a visualized prescription. You have an ophthalmologist, they have an eyeball coming out into a 3D map in which they'll show that this nerve, probably some nerve hitting in back to your brain, is not going around. A whole full 3D scan to increase the doctor-patient interaction. Why are we so troubled that the patients keep on calling us that, oh doctor, ye dawai de di hai, kya ho raha hai? Because the doctor-patient communication is not well enough. It's only to a prescription, a patient comes in and a doctor writes something and that's on. Until you go beyond that, you give him a probably 3D picture and explain that your liver is having this abscess or some cirrhosis or somewhere in this point of time through 3D mapping, that is where it moves on. Lot of startups, I mean, they're only purely working on doctor-patient consultation. Doctor, I mean, you name it, Doc Talk, Doc Walk, Doc Sap, Insta Doc, Mera Doctor, Gaon Ka Doctor, Sheher Ka Doctor, itni sari apps hai, but all of them are still struggling just to make the doctor-patient consultation. Then there is a good amount of reason, because the doctor is always short of time and the patient can keep on pinging, but the gap will still be there. So many things. And until that communication is resolved, all these apps will still have a pain point. So in the end, you have the data. Let's assume somehow we are magically able to succeed and get good amount of data in a digitized format. The end result, where does the AI and your big data kick in and your cloud computing and your blockchain kicks in, is into the analytics aspect. I've given you a few examples already. Analytics is the most wonderful thing. It would save humongous amount of time from doctor's perspective, from patient's perspective, improve clinical data to almost 99% accuracy, give amazing results only if we are able to apply that analytics on. It would become a fact-based machine system. It has already been implemented into multiple European countries and US countries, a smart system called CDIS, which is smart-based clinical decision intelligence system. So a lot of those things are already out there, but India faces its own challenges, and I'm very sure that we'll be able to overcome these challenges very soon. So, and finally, it's almost an amalgamation between telehealth, tele-home care, teleservice, teletriage, everything, until it becomes an integrated, a whole ecosystem of adoption of technology. One thing would obviously lead to other. It's like a full stack of cards. When one thing is adopted, I'm very sure that we are already having telehealth, but there is a big block in between both of them. The two systems aren't communicating with each other. And once that kicks in, the whole ecosystem of technology, and then furthermore, the reduction of cost in a hospital would kick in. So, my friend, in the end, thank you. And I hope everybody embraces technology, because without that, we'll only be seeing other Flipkarts, other Paytms being made. But in healthcare, we need to see our own Paytm or Flipkart being done very soon. And I'm very sure any one of you in the audience would make that possible very soon. Thank you.